My name is Emily Lau. I am a General Cardiology Fellow at the Massachusetts General Hospital in Boston. My research team, we work specifically at identifying risk factors for heart disease, in particular heart failure. And in part of that work, what we were realizing was that many of our patients were actually dying of causes that were non-cardiovascular related. And when we probed further, we found actually that there were higher risk of cancer deaths in this population. And so that really was the initial spark for this present study. And so essentially we looked within the Framingham Heart Study to identify risk factors and the associations of cardiovascular disease and cancer. We looked at a couple of things specifically. First, we looked at a number of risk factors. We then looked at risk scores like the atherosclerotic cardiovascular disease risk score, the 10-year ASCVD risk score. We looked at biomarkers, both BNP and troponin. And finally, we looked at the development of interim cardiovascular events. And essentially, we really wanted to identify what were the associations of heart disease with future cancer and cancer death. And I think the findings were really interesting. I think we've known for a long time that cardiovascular disease and cancer likely share a number of risk factors like age, smoking, but we also found that other risk factors such as hypertension and diabetes, things that we particularly associate with cardiovascular disease, also seem to be linked to higher rates of cancer. And then when we delved further, we found that folks with high 10-year ASCVD risk were actually at significantly higher risk of developing future cancer. And this is a risk score that many of us cardiologists and primary care physicians use to help us determine how aggressive we need to be at treating risk factors in order to prevent cardiovascular disease. And so it's very interesting that in fact that potentially this risk score may also be associated with future cancer risk. There's still a lot of unanswered questions. I think the big question in our field is the link between heart disease and cancer really because of shared risk factors? Or is there really a causal pathway? Does having increased heart events actually predispose you to developing cancer? I think that question is still unknown and unanswered, although there's a ton of work being done in that space to try to better understand the mechanisms. But what I will say from our study is that when I see a patient with, I plug in their risk factors into our 10-year ASCVD risk calculator, and I see that they have a risk of greater than 20%. So somebody who's very high risk of developing heart disease in the next 10 years. I will now not only think about being very aggressive at managing their heart risk factors, but also I need to be thinking about what their future cancer risk is. Even for our present study, we obviously studied this in a huge number of patients within the Framingham Heart Study, but it is one population. And so we are actually looking to validate these data in another population, and we're working with collaborators in the Netherlands that have another very large cohort, called the PREVENT cohort. And so we are actively trying to replicate our data to see if in fact these associations remain true in that population. And I think if that is the case, it will only really give strength to our study and sort of further this concept that in fact cancer and heart disease are very much linked, and that we need to do more work as a scientific community to really understand why that's the case. I would say that this is a very exciting time to be working in this space. We know that heart disease and cancer are two leading causes of both death and morbidity in this country, if not worldwide. And I think it's been extremely interesting to see so much work being done in this space, and we are increasingly recognizing how intimately linked the two of them are. I think it has a lot of potential for helping our patients in the future.